Good evening, good evening. My name is Angela Fullwood, and I'm the supervisor for family and community engagement with Hillsborough County Public Schools. And I am so excited about this month, Black History Month, Black Health and Wellness. And tonight we have a special treat for you because we're going to learn all about who Clara Frye was. Tonight I have with me Clarence Civilian. He is he has a bachelor of mathematics from Vanderbilt University in Nashville, Tennessee, a Bachelor of Health Science, University of Michigan, in Flint, a MPT, physical therapy, and from the University of Michigan, Flint, and an MBA from Lawrence Technological University. He has worked as the president and CEO of McLaren Bay Regional, president and CEO of McLaren Oakland, president and CEO of Doctors Hospital of Michigan, COO of McLaren Lapeer region, director of business development, sports medicine at McLaren Flint, staff physical therapist at McLaren. I hope I'm saying that right, Mr. Civilian, Flint, but he currently is the regional or executive vice president and COO of Prism Health Systems. And so we're excited to have him. Welcome, Mr. Civilian. Also with us, we have Dr. John Strivens Jr. He attended Florida A&M University, where he earned his Bachelor of Pharmacy. He earned his Master of Pharmacy from the University of Florida and his PhD from USF College of Public Health. He worked at the VA hospital here in Tampa, clinical pharmacist in Tampa and Ohio, in Dayton, Ohio. He finished his career as the director of pharmacy practice at Florida A&M College of Pharmacy in the Central Florida region, which serviced students in Orlando, Tampa, and St. Pete, and retired in 2014. So welcome, Dr. Strivens. We're so glad you're here. And also with us, we have Mr. Fred Hearns. Now, Mr. Fred Hearns, he has a BA degree from the University of Florida. He worked as a reporter for several newspapers. He was a sports information director at Southern University, and he retired from the city of Tampa after 32 years as an executive assistant to the mayor. He currently is the curator of Black history at the Tampa History Center. So also with us, we have Mr. Fred Hearns. So welcome, Dr. Strivens, Mr. Civilian, and Mr. Fred Hearns. How are you today?
Doing great. Thank you.
Great. So as I said before, today we're honoring Black history. We are recognizing the achievements of trailblazers in the health, science, and wellness. Black individuals who really have contributed vital accomplishments to our medical community and to our healthcare systems, often overcoming great hurdles. So I'm going to share my screen because I created a little presentation, a quick little overview of some very important people in this industry. So really, Black Americans really have been a part of the crucial healthcare advancements even before the United States really became a country. So what I want to do is talk about a few of the unknowns. An enslaved African named Onesimus lived in the, he really saved countless lives in the early 1700s by sharing the African practice of inoculating against smallpox, long before Edward Jenner became famous for creating that smallpox vaccine that we all take. 2 centuries later, in 1917, a Black doctor and antibiotic pioneer named Lewis T. Wright would develop the intradermal injection for vaccinating against smallpox. So Onesimus is his name. Another man born enslaved made his mark on the medical world, becoming America's first Black doctor. In 1783, Dr. James Durham, he bought his freedom and began to practice medicine in New Orleans using the medical knowledge that he gained from his slaveholders who happened to be doctors. Now, although the city restricted his practice because he lacked a formal medical degree, Durham impressed many of the country's foremost physicians due to his success in treating diseases like diphtheria and yellow fever. James Durham. The first Black U.S. Army nurse was also a woman born enslaved. Susie King Taylor, she was born Susie Baker, served as a nurse during the Civil War and later helped organize a branch of the Women's Relief Corps. Susan King Taylor. In 1893, a Chicago physician named Daniel Hale Williams performed the first successful human heart operation. His patient had been stabbed in the chest, but thanks to Williams, he went on to live for decades more. Daniel Hale Williams. Dr. Solomon Carter Fuller is considered the country's first Black psychiatrist. He served as a graduate research assistant to Alois Alzheimer's, the man for whom the disease is named, in Germany in 1904. Afterwards, Fuller continued to research degenerative brain disorders and translated Alois Alzheimer's work into English and was widely published as an expert in Alzheimer's disease. Dr. Solomon Carter Fuller. So there are many of these trailblazers, and I'm going to put I'm going to place a document that chronologicals all of the achievements of African Americans in medicine in the chat a little later. But today we want to focus on the history of a local trailblazer in Tampa, a nurse named Clara C. Frye. I'm going to leave that picture up. So I want to speak with our panelist that we have today, Dr. Strivens. Can you tell us a little bit about Clara Frye? Who is she?
Okay. Well, thank you, Angela, for this opportunity to share some thoughts and some praise, actually, for the historical and very, very, very necessary work that Ms. Frye did. I came along in the 50s and 60s. So, when I was young, and when I checked with some of my classmates and friends and people that I knew, almost all of them who had been born in a hospital was born in Clara Frye Hospital. Okay. Now, I never really thought very much about it. It was just another hospital. During that time, it was going through a lot of turmoil because they weren't getting the support that it needed, the financial and logistical support that it needed in order to flourish. So that was always a political battle going back and forth, because at the time it was a city hospital. But before it became a city hospital, Miss Frye, who had come from England, and she had lived in Alabama for a while, and she had some unstructured but good training as a nurse, and then she and her family moved to Tampa, Florida, and that was in about 1901. When she came to Tampa, there was no facility to treat Black folks. The policy was that Blacks could not be admitted to Tampa Municipal Hospital, which was the forerunner for Tampa General Hospital. So Blacks had to be treated elsewhere, and that's one of the reasons that most of the people that I grew up with were they were born in their own homes and places like that, and they had midwives who actually delivered a lot of these people. They had no place that they could go, no hospital. As a matter of fact, if it wasn't for a place like Clara Frye, then they would have nowhere to go, because there were no other alternatives. Okay, now Miss Frye lived over in West Tampa on Lamar Street, and she had this 3-room cottage. The legend is that one day a prominent Tampa physician named Dr. M.R. Winton had asked Ms. Frye if she could help him care for this, what do you call it, this hardworking colored woman who had little means and no provisions. And he needed for her to be cared for while he prepared her for surgery. She was suffering from a tumor which needed to be removed, and Dr. Winton was going to be the one to remove it. So Mrs. Frye agreed, and she suggested to Dr. Winton, said maybe we could improvise and make an operating table in the cottage, and this could maybe suffice. And she could live in my, she could stay in my bedroom, and I would sleep on one of these floor pallets, which she did. Dr. Winton performed the surgery and the patient recovered and everything was good. So Mrs. Frye, because she had done that, wound up with 3 more patients with varying diseases, and then 3 more, and then 3 more, and on and on. So that became a place where the Black and other underserved could go and receive adequate treatment. Okay. Mrs. Frye suggested that that the instruments that they are using for surgery could be sterilized, and according to Miss Mary Cash, who was Tampa's first, not Tampa, Florida's first registered nurse, Black registered nurse, um, that that they could sterilize their instruments in these big pots in the backyard of the cottage. Okay, the cottage was also Mrs. Frye's 3-room home. Okay, um, I'm trying to include everything here because there's a lot in here, and we don't have the time to go through all of it. So I'm trying to give you some chronological pattern that things happen. Okay. After some of these patients were treated, Dr. Minton's patients, he kept referring them to her, and she continued to care for them. And she would never, and this was very important, she would never press her patients for payment. If they had money, that was fine. But most times, the people that she served were poor. They didn't have any money. So, but she used her own monies and her own resources to provide for those patients. Okay, now this went on for a while, and then about 1923, the hospital was deemed as too small to care for the growing population of Black folks in Tampa. So with the little monies that she and her, we call them candy stripers nowadays, but these are nursing assistants. They go downtown and they have the little bell going and they have the uniforms on, and people pass by, then they just give donations. And that was where she was getting the bulk of the funds that she needed to run the hospital. But that truly was grossly inadequate. So Dr. Minton, that same physician, he loaned her $1,000, and for which she took, along with her other meager funds, and bought this warehouse, which is across the street from where her original home was, her cottage was. And they renovated it and actually made it a hospital. Now, that hospital became the hospital for a number of years after that, because he kept adding on to it and doing certain things to it here and there. But the city actually had no ties to it, no responsibility for it. but since she was performing this kind of service, then their standards had to be measured and met. So the people who actually came in and evaluated the quality of care at Tampa General started to look at the Clara Frye Hospital. And they found that, it was grossly inadequate for almost everything. They said the building wasn't fireproof. It had no means of maternity care. It had inadequate provision for drugs and just a whole laundry list of things that needed to be done to to adequately and safely perform medicine in the city here. Okay. With little means of support, she continued to struggle to keep her little hospital alive, and it didn't have the equipment that it needed, and the conditions that they ran were considered questionable. Okay. The people who actually did the report, the Rapper report, they called it, and mainly because one of the people who actually wrote the standards for evaluating a hospital was Mr. Arthur Rapper. Um, he was very careful not to criticize Clara Frye. He realized that she was doing the best that she could, and she was the only game in town. As a matter of fact, the co-chair of this group that that uh, that dedicated itself to getting the Clara Frye a legacy documented and honored. Dr. Rudy Twiggs, he was a dentist that was here in Tampa. He was quoted saying one time, say like, "Hey, it's like this. If you don't get treated at Clara Frye, it's nothing else left for you." That's all they had. So he was careful not to criticize Clara Frye for the quality because he was quoted as saying, "Only a few people know what Mrs. Frye has given in her efforts to maintain this hospital." Yeah. So anyway, he did talk about the services. To skip ahead and to stay within the time limit here, um, Clara Frye worked at this hospital for 28 years. And during that time, she got as she got a little older, she started having all kinds of problems, arthritis and all kinds of things like that. She could hardly walk. The city came along and they purchased the hospital from her. And when they did, they allowed her to continue to work. And that was in 1928. They allowed her to continue to work as long as she, in a sense, wanted to. But by then, when the city did buy the hospital, they put some more resources in there. And they had their very first African American physician who was actually on Tampa General staff. He became the administrator of the Clara Frye Hospital as well. But he worked with her, and they kept the hospital going for a while. But she just could only go so far, and she got sick. She retired, and she bought another home, and she wound up losing that one as well. And then she died on April 8th, 1936, at the age of 63. Okay. Um, in 1938, with funds from the Progressive Work Fund, the city completed a new Negro hospital for Blacks. And it was on Union Street and Riverside Drive. It's the current location of the new Howard W. Blake High School. And that's where the Clara Frye Hospital was. The city came back and renamed the hospital the Clara C. Frye Memorial Hospital a couple of years later. And when they built their new hospital in 1938, um, they ran it, and it was a political football as far as trying to get resources to make the hospital function like a normal hospital. So it was back and forth between how many funds they could get and what they could be used for, and if they got any funds at all. So the Tampa Municipal Hospital, Tampa General, they had the lion's share of the resources that were allocated for hospital care, and Clara Frye got, in a sense, the scraps. They said that they criticized the administration of the hospital so badly, that some of the local citizens rioted to get more funds so that Clara Frye could exist. And then at the time they were talking about closing it. They did close the hospital in 1973, in 1972, and then they demolished it in 1973. Then when that happens, this whole legacy about healthcare had, in a sense, come to an end. About the legacy of healthcare for African Americans was coming to an end. But by then, the people, the Black citizens, were allowed to go to Tampa General Hospital. Now they had segregated rooms and the services, had some of the typical problems that they have in these separate but equal societies. But Black folks did receive the permission and support for going to get hospital care. But the thing is, the person who had pushed this thing for all those years, 28 years until they died, was Miss Clara Frye. And there was so little written about her accomplishments in history. And people ask me sometimes, well, why did you all make this such a major project during the year we did, and that was in 1991? Why did y'all make this such a major project? And the thing is, because she did it and nobody seemed to know or care. I even asked some of the people who I grew up with, and I probably would have been asked the same thing too. Have you ever heard of the Clara Frye Hospital? And my children, never heard of it. And some people who are older than they, and if they weren't born in Clara Frye, they knew nothing of Clara Frye. And that was too important a period, and too important a project to be overlooked and not known and underappreciated.
I totally agree. And that, and in that sense, it was very hard when I was Googling. I found very little about her. I one picture, and it's that side picture. So I want to talk a little bit. I want to direct this question to you, Mr. Hearn, since you know a lot about history. So between 1865 and 1960, there was what we call the Black Hospital Movement. Can you tell us reasons for this movement and what was it about?
Well, you have to look at the 1964 Civil Rights Act and the other legislation on the state and local levels that followed that forced desegregation. Mm-hmm. As Dr. Strivens just described, prior to that time, when there was segregation all over the United States, and especially in the South, Black people had to fend for themselves. You had angels like Clara Frye. Thank God that she decided to live in Tampa, who gave all that they had. And this woman died impoverished, even though she was responsible for so many lives that were saved and for improved health of thousands of people who came her way in Tampa. When it came to her being able to live a productive life, she died at the age of 63 when she probably could have lived much longer than that had she been receiving the type of attention that she needed personally. Mm-hmm. But once desegregation began to make its way across the land, Black hospitals and Black people, Black medical care technicians and doctors and nurses and other folk who worked in these facilities, many of them were able to transition over to hospitals like Tampa General Hospital, finally. My mother worked at Clara Frye Hospital at the time when it merged, for lack of a better word, with Tampa General Hospital. We know that the same thing that happened in Tampa happened in other areas that were fortunate enough to have a hospital where these people were not didn't have to travel to another city or another municipality to receive medical care. Something I want to mention that Dr. Strivens was being so modest has not really talked about. The movement that he championed to get the recognition for Clara Frye at Tampa General Hospital, as well as a memorial sign that sits in front of the Howard W. Blake High School, which had been the location of Clara Frye Hospital for many years, and also the 9th floor wing at Tampa General Hospital, which is now named for Clara Frye. And in front of Tampa General Hospital, as you enter, there is the Clara Frye Pavilion. And whenever I'm at Tampa General Hospital, I stand over there and kind of linger for a while and try to attract people's attention over to that plaque that has her image and some documentation there about who Clara Frye was, what she did, and what she meant to Tampa. We can't talk enough about that. I know you didn't ask this question, but I do want to say that when the Tampa Riverwalk was completed and the Friends of the Riverwalk, which is a 501c3 organization, decided that they wanted to do something to recognize individuals who made a difference in Tampa, I was the only African-American on the selection committee. And the very first name that was put forward for recognition with a bronze bust on the Riverwalk was the name Clara Frye. Nobody else was even close. I wanted to make sure that, because I didn't know when the funds might run out, Dr. Strivens. So I wanted to make sure that if they only put one African-American on the Riverwalk, that African-American was going to be Clara Frye. And the beautiful thing about the end of this story is that the bronze bust of Clara Frye is in Waterworks Park, and she's looking right across the Hillsborough River toward
Blake
former
High
site of Clara Frye Memorial Hospital,
Wow.
which is now Blake High School.
Wow.
And so I'm going to encourage people, as you visit Waterworks Park and you find the bronze bust of Clara Frye looking over across the Hillsborough River, stop and read the inscription there and encourage other people to do the same so that we can continue to tell these stories and pass them down to our children and our children's children. I don't know if I answered your question, but I thought it was important for me to make that comment.
You did. Thank you so much. And I wanted to bring in Mr. Civilian to this conversation, because thinking about what Clara Frye did, it had to be truly amazing. You talked about some of the hardships. And so from your perspective, you know about hospitals and how to run hospitals. So tell us a little bit about what your current role is, what you do. And then could you talk about how, thinking about what both of Dr. Strivens and Mr. Fred Hearns talked about what Clara Frye did, how difficult would it have been able for them to stay open? Could you talk a little bit on that? First, tell us what it is you do, and then talk about how difficult it would have been.
Well, thank you. And wow, I mean, so I ask myself that sometimes every single day about what it is that I do. And especially in this day and age of COVID and what that has done to our healthcare system overall. And obviously we're adapting every single day. But, you going back to some of the comments that, were made with Dr. Strivens or Mr. Hearns, and that is, at the root of who we are and why it is that I do what I do right now today is based off of things like Clara Frye. During her tenure as a nursing student, she had many stories about Black patients dying because they were denied treatment in segregated hospitals. And when you think about that and appalled at those statistics that she had overall, and actually, taking patients and, no matter what their ability to pay was, and oftentimes had no ability to pay, and into her own home. Is something that at the root of it is about finding good humans and trying to define your purpose as an individual. So it really drives me what I do today and to help people and to make a difference overall. So at a 30,000 foot view, what I do today is I try to look at the communities in which we serve and how do we have an impact in a much larger way in a integrated delivery system of looking at patients prior to coming into the hospital and all the way for when they have to go home and beyond. And so, again, how do we make that difference in leading the initiatives? We have the responsibility in the healthcare system right now. What I do is, how do we make sure that the healthcare system works efficiently? How do we look at the patient everywhere from, again, before coming into the hospital on the wellness side, all the way to when they exit the hospital into the home setting itself. And I manage day-to-day operations. I look at strategic initiatives about where it is that we need to go, looking at that technology and overall strategy, again, tying it back to our communities of which we serve and looking at how do we make an impact in addressing the concerns that we have in each of our respective communities. At the end of the day, what we really are trying to do is deliver the best quality of patient care, safety that we can possibly provide, and provide that leadership and a culture that can foster that good healing environment overall. So that's kind of what I do today, and looking at how do we make sure that we're giving the best to each of the communities of which we serve. Now, going back and looking at how tough could it have been to run a hospital back then. And you heard some of the challenges that Dr. Strivens talked about, or Mr. Hearns, in terms of just resources, supplies, ability to pay, and all those sorts of things. It's quite honestly, it's not indifferent from what we have today, and some of the challenges. However, not only what we have today, you could probably amplify that by 10 for what could have been experienced back then. Because running a hospital is complicated. It's not an easy task. When we look, we're not dealing with widgets. We're dealing with human lives and people. And one small mistake of a computer error can truly lead to a death. And that's things that we have to consider when we look at how to not only run a hospital, the things that we have to take into consideration overall. But, some of the key components of running a hospital is the things that we think about the most. And that starts with who? That's our staff. Our most valuable asset that we possibly can have are the people that we care for, that cares for, the patients that come into our contact, and that is the lifeblood of our organization. So, think about today and the challenge that we have with our workforce and having the right amount of nurses at our bedside, or the right physician complement to care for our patients is certainly something that we have to deal with today, and the challenges that we have. But at the same time, think about what it would have been back with Clara Frye and some of the challenges of finding the right people to be able to care for the patients. Oftentimes it was volunteers that had to come to the forefront to help at that point in time as well. I talk about a network of and I'm going to relate that to today versus, back then. And quite often right now, most successful hospitals today rely on our staff workers to keep things moving smoothly. In addition to that, we have to think about, the medical providers, our physicians that we care for. We have to think about, and I say a post-acute care setting, our nursing homes, our ambulatory, our assisted living facilities, our rehab facilities. We have to think about our health plans plants and the things that we have overall. We have to think about EMS services, social work, nursing homes, all those things come into play. We have those resources today for that continuity of care. But back then it was you go home. And you didn't always have that, so that the resources, so to trying to drive the quality of care and the results that you need back then versus today, I can only imagine the complications. Again, think about it. People got into it to try to make a difference, and could you completely do that without all the resources that you possibly needed to have? Then you complicate it a little further today. And I'll be brief, but think about it today with, running a hospital and looking at I'm going to say accreditation and standards. Often if you go back and look at some of the readings that you have, and when they start to enforce standardization and accreditation types of standards, and what that means is this more rigor around operating as a hospital. So oftentimes there were hospitals that actually went out of business because they weren't accredited, as an example. So it depleted the resources and the ability to take care of patients because of some of the inadequacies that were there. And it wasn't because people didn't want to, they just didn't have the funding, the resources to maintain a lot of that. So now you take it to another level of trying to manage supplies, trying to manage, how do you have, we heard about sterilization of instrumentation so you don't get infections. Those are things that we have to think about today in today's environment and highly regulated. But then you take it back then of trying to just maintain those sorts of things is that much more difficult. And even to the point where, they had food shortages and supplies and things of that nature to care for holistically of our patients. It was challenging overall. So things that we have to worry about today are not unlike what they had to do back then in Clara Frye's days. But I will tell you, it was much more challenging back then, Angela.
Thank you for that, because that gave a huge scope of how difficult it would have been for her. And wow, that was truly an eye opener for me, because you think about the inadequacies with the financial piece, but you're not thinking about all the other pieces that you just mentioned. So thank you for that. So I want to go back to you, Dr. Strivens, because as we know, there is a dedication at the hospital, Tampa General Hospital. What inspired you to lead that dedication to Ms. Frye?
The fact that it wasn't there. Nobody knew of her and all the work that she had done. Dr. Andrew Jackson had come over to, at the time I was director of pharmacy at the USF Psychiatry Center. And so that gave me, in a sense, the wherewithal I needed in order to kind of pull some people together to let's even recognize Black History Month. Because at the time it was a new place, but they never had a Black History program before. But Dr. Jackson came over, and he talked about the Clara Frye Hospital and the Lily White Hospital too, who was another hospital that was done some years later by the Lily White organization. And they, and how they provided healthcare to the community, and they had little resources that they could afford to do that, but they did it. And and you're right, Dr. Sylvan, they if the Clara Frye Hospital had to live up to the standard, the JCA standards, and people like that nowadays, they wouldn't have made it, because it wasn't that they couldn't do it, they just didn't have the resources, and the city did not give them the money they needed in order to adequately run the hospital. So they were criticizing for fighting with one hand tied behind their back, and eventually they justified closing the hospital and putting it out of service. But but just the fact that this is how it had happened and people didn't know anything about it, we figured people need to know who Clara Frye was, what she did, and how we got to this point.
So, Mr. Hearns, what are some things that you think we could do? We have so many people just like that are so unaware of the many great inventors, the educators, the trailblazers. I know that's like your life's work there at as a curator to keep Black history alive. What are some things that we can do to keep legacies and the truth alive regarding contributions to Blacks in history?
Well, I think there are a number of things we can do, and I'm not sure if I haven't heard of it, if there is an annual award ceremony where we give out the Clara Frye Memorial Award, or we could have a day of, and especially now with the pandemic, public health is the #1 topic every day in the news. The number of people who have lost their lives, the number of people who've been victims of the pandemic, and whether you should wear a mask or not, and all of the debates that we see going on, a lot of the nonsense that's really not rooted in science, but in myth. So I think that we can keep that name alive. And now that we have a pavilion, and now that we have a bronze likeness of Clara Frye at Waterworks Park, an annual festival in Waterworks Park in her name. I mean, there are a lot of things that we can do today to keep her name alive. And then that arouses people's curiosity. Well, who was this lady? Why are we honoring him? Why was she important? What did she do, that warrants having a day set aside to recognize her? We can honor more Black people, no slight intended here, above and beyond the Reverend Dr. Martin Luther King. As important as he was, he by no means was the only important Black person who contributed to our lives and to our future and our children's future. We could have a Clara Frye Day. I mean, we really could do it. We could make that happen, okay? As Dr. Strivens just said, government didn't help fund Clara Frye's work until way down the line. I mean, in 1908, when she first opened her home to that first patient to have that tumor removed, and for the next 15 years with no government assistance until in the 1920s. I mean, my God, thank God for churches. Thank God for people like Dr. Winton. Thank God for people who, who didn't probably have much themselves, who dug deep and helped to keep that hospital going. And here we have this woman now who's buried at Woodlawn Cemetery. Her name is not even on her tombstone.
Let's talk about that, because I want to bring that up.
Yeah.
I know Dr. Strivens and I were talking about that.
Yeah.
Dr. Strivens, so she did a lot, like Mr. Civilian said, it's the dedication of your life, because you care about people. And then she ended up, let's talk about how when she died and her tombstone. I'm going to bring a picture of that up.
Yeah. Well, when she passed, I think she was broke. Now before that, she had she had bought some other plots for other members of her family. I think it's her father that is just to the right of this headstone here. This headstone was one that the committee arranged to have put down. It was paid for and given to us by Wilson's Funeral Home. But because she did not have a headstone with her name on it, we thought that the other thing that we could do to really close out our whole effort to have the whole Clara Frye recognition done was that we needed to have her name here. And people need to know who she was. So on her headstone, do you have a picture of the old one, of the original one, Angela?
I don't.
Okay, well, if I could pull out my wallet, I could see. But anyway,
you probably couldn't find it because her name's not on it.
Right. Well, it is right in front of the one you just saw just now, but because we put that at the head of her grave, and the other one was at the foot of her grave. And it was just a simple stone. And it read, "To our dear mother and sister, gone but not forgotten. Now we don't know who the sister was or anything like that, or I know she had two sons, and then they were around Tampa for a long time before they eventually disappeared somewhere. And I think somebody said one was in North Carolina, but our efforts did not go that far. But by then they probably were not alive too. But anyway, we needed to have a place in Woodlawn Cemetery where they could go and see where Clara Frye is buried. So her old tombstone is still there at the foot of her grave. And the new one that you just showed a picture of is at the head.
Okay.
And
So
that was
yeah,
what we did.
yeah, and that's why, even today I was attending the Black History Brain Bowl for elementary, part A, I guess the west side of town. And, they were asking a lot of questions to the students about history. And I would love to see some of these questions come out about more local trailblazers, if you would, in the community. People who have made a difference. And I know I saw the last issue of the Florida Sentinel, they were talking about all local trailblazers and all of the many schools or parks, courthouse, things that are named after important trailblazers, people who made a difference, and little known history, like you really don't know. And we were talking over lunch yesterday, and Mercedes, my colleague, was like, I did not know all of these schools were named after African American, and it described what they did, what contributions that they made to the Tampa area. So I am so pleased with learning about Clara Frye. I wish more people would know about her, the hospital, and just like Mr. Hearn said, go to Tampa General and stand in front of the pavilion to take a look at what it is, or go to the bust, the bronze bust that's on the Riverwalk, and read about it, so that we have passed this information down from generation to generation. It's just so important that we don't forget. That's really what history is about. So with that, Mr. Sylvan, are there any last words? What does any last words for you?
Yeah, I guess the only thing I would say is, first and foremost, without these individuals, I'd say the state of medicine would truly be at a deficit. You think about it, without these trailblazers of, think about it back early before the 1900s, where, if you were wealthy, you really received treatment at home. When the hospitals came about, it wasn't because you were wealthy. It was in the most impoverished areas overall. A lot of inequities that were in healthcare, and understanding that, African Americans were excluded from most hospitals at that time. And you think about, lack of funding, finding the right equipment, finding the right supplies to care for your patients, doing what you had to do to be able to care for the patients in the community, and wrap yourselves around it, going after philanthropic support just to try to keep your doors open. It was that kind of, I guess, drive that truly, also fostered that education, learning, teaching that allowed us to be who we are today in medicine, and to have that mindset overall. And so did it produce Dr. Daniel Hale Williams in 1893 to do the first open heart surgery? Did it produce Mary Eliza Mahoney in 1879 as a significance in how to integrate into nursing, and do that integration of nursing? Or Dr. Dorothy Brown, who was the first African-American woman surgeon in the South? Those things would not have happened without individuals like Clara Frye, who gave the passion, gave their effort, gave everything that it took to be able to care for humans and to have a purpose overall. So have they made a difference? Were these pioneers, or were these individuals truly trailblazers and making a difference overall? The answer is 100% yes. And I'm very appreciative as a result of it.
Yes, thank you for that. Thank you for that. Any last words for you, Dr. Strivens?
Yeah, do we have time for me to share what's on that plaque?
Yes.
Okay. here is, I don't know if y'all can see this, but this is a, yeah, this is a picture of Mr. Newell France and Lois Nixon. He was the president of Tampa General Hospital, and Mr. Nixon is the chairwoman of the Hillsborough County Hospital Authority.
Okay.
Yeah. Anyway, on that plaque, that plaque you're sitting there, it says, Miss Clara C. Frye, a devoted humanitarian, was born April 17, 1872. In 1908, she began using her training as a nurse, her home, and funds to provide for the haven of healing of Tampa citizens. She built the first hospital for Blacks in 1923. After operating her facilities for more than 28 years, never pressing patients for payment, Ms. Frye died impoverished on April 8, 1936.
Mm.
The city of Tampa purchased the hospital in 1928, and 10 years later, opened the Clara C. Frye Hospital at the foot of Union Street and Riverside Drive on land donated by cigar manufacturer Harry Roberts. Overcrowding, lack of funding, insufficient staffing, and political and economic manipulation led to the hospital's closing in 1967 and to its demolition in 1973. City of Tampa transferred all staff and patients to Tampa General Hospital. This pavilion is dedicated to the memory of Ms. Frye and hopes that her spirit of compassion and her caring for all citizens will inspire those who enter these corridors. And that is the story of Clara Frye
Thank you for that.
in a nutshell.
Thank you for that. Fred Hearns.
Well, I want to thank you for shining the spotlight on this wonderful American, Clara Frye. One other thing that we didn't say, I think we might have hinted at it. If you've seen a photograph of her, she looks white. She looks like a Caucasian. Some people said she was mulatto. We know that her father was white. Clara Frye could have easily passed. Okay, and that's something I wanted to mention before we close this program, how unselfish it was of her. And there were lighter skinned African-Americans who did pass for white and lived that life of luxury that skin tone would have afforded her. She went in the opposite direction. She identified with Black people. She loved Black people. Think about converting your home into a hospital, which means you're living in a hospital. She did that for all those years with no pay, with no one subsidizing the work that she did, depending on the goodwill of Black people, white people, and just trying to make ends meet day after day, month after month, year after year. She did it. The name Clara Frye is a name that we should all lift up high and tell the story that we've told today, again, to the next generation, so that we don't forget from whence we came, so that we don't take it for granted when we go to any medical facility, our insurance, our funds will allow us to go to. Made possible by the sacrifices of this great woman, Clara Frye.
Well, thank you for that. And I do have one question from the attendees. They want to know, is there a Clara Frye Day in action?
Dr. Strivens, if there is, I'm not aware of it.
I'm not aware of a Clara Frye Day, no, but I think it's a good idea. And in case there are some other people who might be listening now and who can get a seed planted in them, just as Dr. Jackson planted one in me, you know, to go out and then do something about it. Hey, some of these nursing programs around Tampa at USF and at University of Tampa, at HCC, you know, they could have some commemoration of Clara Frye there. It'll be nice to name some of those programs Clara C. Frye. You know, just a thought.
That's a thought.
That's right.
That's a thought. So any of you on the line, if you have If you have some powers or connections or influence, let's get it done because she really deserves it.
Mhm.
She really deserves it, thinking about all of that. And it's just truly an honor for me to highlight Clara Frye, and I was very happy to. So with that, I thank you all for being with us tonight. And again, our YouTube channel is in the chat. If you want to, this will be posted, this session will be posted in our YouTube channel. So subscribe to the channel. Anytime a new session is uploaded, you will get a notification. It'll go ding, 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 and you can share it. Just copy the link and share it with your family and your friends. So if there are no more questions, we just want to thank you and have a very, very good night.
Happy Black History Month.
Thank you.
Thank you very much, Angela, and Mercedes.
Yeah.
Yeah.
Like
Okay.
the car.
Thank you.
Thank
all for
you.
inviting
Thank
us.
you for being here.
Well, thank you for inviting us and giving us this opportunity to participate.